Welcome to CLOSA's webinar on the results of the CLOSA data audit. My name is Jennifer Simons and I'm the new director of CLOSA. So to give you a bit of background, in late 2021, CLOSA was invited to undertake a data audit of the over 70 ESRC and MRC funded longitudinal population studies. The purpose of the data audit is to provide a baseline of information for both funders ahead of commissioning Population Research UK, which is a new £9 million UKRI investment. The existing partnership that CLOSA has with 19 of these longitudinal population studies means that we already had an established relationship that facilitated carrying out the data audit. The data audit also built on a previous exercise that CLOSA did on training needs prior to the pandemic. So our speaker today is Jon Johnson, who many of you will know. Jon is a technical lead for CLOSA. He leads the development of CLOSA Discovery. Jon is also the chair of the executive board of the DDI Alliance, whose standards underpin the majority of social sciences data archives around the world. Jon was also previously the senior data manager at the Centre for Longitudinal Studies between 2003 and 2017. So welcome, Jon, and we look forward to you sharing the results of the data audit with us. I'll hand over to you.
Good, thank you. So I'm not sure this is the third or fourth of the series. So we've been trying to have a series of webinars around the subjects of metadata. This is entirely about metadata. We will touch on it during the presentation, but it's really to help to sort of inform people more about metadata, which doesn't get spoken about enough, in my opinion. But then I would say that, of course. Right. So the so we're here to talk about the CLOSA data audit, which we carried out recently. So just a quick overview. So we'll do a little bit about CLOSA itself for those people who haven't come across us before, not been aware of us. A bit about the commissioning process, survey, the follow-up, and then substantively on the report itself. So I'm going to be covering data access, data linkage, and barriers, which are three of the topics in the report. It's wider than that, but I'm not going to do everything this afternoon. And then I'm going to quickly go through the report recommendations for those people who haven't had a chance to look at the report beforehand. Okay, so I hope people had a chance to look at the report, and there's going to be plenty. I mean, I hope to not go over half an hour, so there'll be plenty of time for questions, feedback, and discussion on the anything I've said, or the recommendations, or anything that you think is important that's related. So CLOSA's a UK partnership of social and biomedical longitudinal population studies, the Data Service, and the British Library. We've been going for 11 years now, and our current grant runs through to October next year. We're ESRC funded. We're based at the UCL Social Research Institute. So our mission is to increase visibility using the impact of longitudinal population studies, data and research, and to facilitate interdisciplinary research and encourage cross-study analysis, provide resources and training opportunities for researchers, mobilise evidence and insights to policymakers, and represent the LPS community on an international and a national stage. So we have a flagship product called CLOSA Discovery, which is a metadata platform to allow people to search, explore, and access data from our 11 studies currently in Discovery at the moment. And yeah, you can see the amount of information there. So it's pretty much the biggest cross-study resource in the world, and we're pretty proud of it. And please do go and take a look if you haven't seen it before, and if you have, take another look. And then other things we do in CLOSA, which are no less important, are we have a learning strand. So we have a learning hub which has got information resources that cover a range of issues around longitudinal population studies, from very basic stuff through to use cases, case studies, and some things like cross-study guides and just a range of resources. Anyway, take a look. It's a great resource. The other area is evidence. So we do a lot of work promoting longitudinal studies and doing work around summarising the insights from the wide range of longitudinal studies in the UK on a range of the many topics that are covered by UK longitudinal studies, which are multitudinous. We work on some innovations around data harmonisation, linkage, and we support sort of helping studies to link to administrative records and make data more comparable, and other resources around society. So we have got a great resource called Our Changing Society, which is well worth looking at for understanding the changes and trends in a whole range of subjects, from births, smoking, a whole range of subjects. It's a really great resource. I'll take a look at that. It's useful for everyone, from people who introduced the subject to think, oh, I didn't realise there was a bump in these figures over a certain period of time. So it's a great resource. So we have 19 studies, and there's all their logos. It's a pleasure to be able to support all these different studies. So on the data audit, so the objectives were, the purpose of the audit was to provide a baseline of information to enable the ESRC and the MRC to understand the current state of the many activities that longitudinal population studies carry out, to better understand where the gaps exist, where improvements can be made, and to plan for future data collection and support for UK longitudinal population studies. So we carried out a survey. It was quite an onerous survey, 77 questions, which is probably short for the sort of studies, the surveys the studies have to fill to their participants. But it was quite a hard survey. Collected a lot of information from the studies around the studies themselves, data collection, samples, data linkage activities, data management, governance, privacy and disclosure, and a few other things as well. We're just massively grateful for the studies participating, because it was quite an effort for them to dig out the sort of information that we were asking for. And we did a follow-up interviews with 8 of the studies, sort of representing some of the main things that we were looking at, and that was really helpful in terms of getting a bit more perspective around some of the questions we were asking. The other thing which I should mention is massive thanks to Alice Bartlett, who came on board to help us with the project, and she did a brilliant job organising the survey, liaising with the studies, doing some of the data prep and so on, so we could have a solid data to do the report from. So that's really good to have her on board as well. So in total we were approaching 71 studies. So in the end, 51 participated. You can see the 49 here. I've excluded Our Future Health and Early Life Cohort Feasibility Study from these stats because they're sort of piloting, or we don't quite know what the baseline figures for those studies are going to be yet. But you can see that it's a really diverse range of studies in UK longitudinal population studies, from quite small. So the criteria of a small, medium, large is essentially less than 10,000, less than 20,000, and greater than 20,000. So that represents the small ones tend to be sort of place-based or specific disease cohorts, and those primarily MRC-funded resources. Things like the Finland study, the Orkney study, Aberdeen. There's a lot of place-based studies that MRC that support. The medium ones tend to be the sort of birth cohorts, so who tend to sample 25,000 people, and then they the achieved sample is somewhere around 18,000 baseline, or average 14 and 16,000 studies. And then the costs, so the large studies are things like you understand society, biobank, ONS longitudinal study, that sort of thing. And we were also asked at the end to look at cross-sectional studies, although only 4 participated, so there wasn't that much we could say about them, and they were primarily the election studies. So one of the things that we haven't done in the study is to try to make very many comparisons between funders or between the studies, because they're such diverse, it's really just not appropriate really to be doing sort of analysis across the studies, because they all have different strengths, and have different histories. So it's not really a sort of, that wasn't the purpose of the audit. So the number of data sets being accessed, I was quite surprised that there was so much data being used by the longitudinal population. I knew it was big, but I didn't realise it was quite as big as this. And I think it does sort of have really, solid evidence about the amount of research that has actually been taking place on these UK resources. The other thing I was quite surprised about was the growth, 36% growth over 5 years, which is 7% compound interest or something like that, which is quite remarkable in lots of sense. And in some cases you'd expect a sort of organic growth of number of data sets being accessed, because as these studies collect data over numbers of years, they collect more data, and you can ask different questions, more interesting, or not necessarily more interesting, but more complex questions as the studies accumulate data. But I think that growth exceeds that. So I think there's definitely been an increased interest in the what longitudinal population studies can offer the research community. So that's an interesting thing. And broadly, that growth was the same, well, pretty much across all studies. They were having the similar sorts of uptake of data set usage. So that's so it's not just not all concentrated in 1 or 2 studies. It's pretty much across the board that's taking place. So it is interesting. There is this broader interest in using longitudinal population studies from the UK. And so this is split for where data are being accessed by researchers, and how, and percentages across the board. So British election study is obviously a massive uptake. It's also the easiest study out of all the studies in the audit to access the data, which I think says something. It's also one of the most simplest data sets amongst all the studies, in, I don't mean a pejorative way, but just there are 30 questions in the election study each wave. There's about 500 variables, which compared to some of the other studies is very, very small. So it's a very accessible study, and that sort of, I think that explains why there's so much usage of that's that. And also everyone's interested in about politics is a very, very common thing. And it's sort of the base user base for that study extends well outside academia as well. Then the other thing which I think is interesting is that, so this relates to the point about British election study, is that the easier the data is to access, the more data is being used. And UK DS end user license, which is what EUL stands for, is one of the most straightforward ways of accessing data. Where data's in TREs, or there's a long application processes, that is having quite clearly an impact on the usage. So studies which are similar sort of content, which are available only in TREs, and compared to data which is available for the from the UK Data Service, is an order of magnitude more accessed. Now, that doesn't necessarily mean that research isn't better or anything like that. It's just a different order of magnitude of accessed. So one of the other areas we were specifically asked to look at was data linkage. And obviously data linkage has been, there's always been some data linkages in the longitudinal population studies, particularly around the spatial, particularly, which has been an important part about understanding local conditions in relationship to the participants. But over the last sort of 20 years, particularly, there's been a big push by the studies to link, particularly to health records, primarily from the NHS, but also DFE records around schooling, and more latterly, employment records, so benefit records, income from HMRC, that sort of thing. And the interesting thing, I think, from my things I wanted to be saying to the funders, or about concluding from this, is the sheer size of what is being planned by the studies and the consequences that was going to have in terms of the effort and the organisation and the sort of barriers, potential ways we can try to reduce the barriers to make sure those data happen in a more timely and efficient way. So with the planned and the possible, you're looking at a doubling of data linkages across those studies. So that was obviously opens up enormous research possibilities, but also has a big challenge in terms of the logistics of actually carrying out those linkages. And one of the things is that the linkage environment, it has changed quite significantly, primarily because the government departments have basically given ONS the responsibility for data sharing, as opposed to originally it was direct with them, which has, I think, in the long term, lots of advantages, but in the short term, I think there's going to be some bumpy things ahead. But so that's got to be dealt with. And how do we manage that? So it's one of the things that I've talked about in the recommendations about how we can try to make that happen more efficiently and so on. So we asked the studies about what their current barriers to data sharing are and what they anticipated to be. So not everyone responded. We had to code these up from the text responses. But there's a lot of red, which is the things they're worried about in the future, and I think things like funding is always a concern of studies about whether they're going to have money to carry on the studies into the future. But I think here that the rate of study growth, the amount of data, recruitment and retention of staff, and training and expertise are some key areas where I think the studies are quite concerned. And it's obviously something that the funders and PRUK are hopefully going to start beginning to address, hopefully. I also asked about a similar question, but also about data management. And again, we've got infrastructure funding, and that's quite important because I think one of the things that was evident from the responses was, a real desire by the studies to really upskill the technology stacks, and obviously that's quite a big thing to do. I think they see a need to really sort of invest in technology to help make things more sort of efficient and allow to do things which they are struggling to do in some cases at the moment. So that's an area where I think there's a key concern, and I think some of the other ones very much match the sort of concerns I have around data sharing more generally. So we also asked them about metadata coverage. Those people who know me will know I'd be quite keen to ask those sort of questions. And it was, I don't know, I was shocked or it was certainly interesting to see that. So the figure on the left is about topical coverage by different vocabularies. So basically, are the studies providing tags with their data to say, is this data's marital status, ethnic group, and so on and so forth, so forth. And that's a really important thing for research. It's a really important part of users being able to understand what data's around in a particular study. And without that, it's quite an onerous job for the researchers to find out what's in the studies. And you know, there's just obviously there's quite a gap there with sort of 60% or 50-60% of studies having no clear metadata indicating the topical coverage of the variables. So they have to substitute by other ways, or researchers have to look themselves. And obviously, that's not necessarily an ideal situation. So figure B is a bit more complicated in a way. So this is the amount. So for each infrastructure, so Closer, Biobank, or Gateway to Global Aging, which covers ELSA, Nicola, and the Scottish Aging Study, the name which I've completely forgotten, I apologise. So that's the amount of data being requested from those studies, and whether there's a discovery platform. So the 3 discovery platforms, they're covered by you know, how much data has been used. And so it looks like, you know, the majority of studies aren't covered by an infrastructure, so they're having to do it themselves, basically, in one way, shape, or form. And that, you know, is obviously a hard thing for them to do. So I think it indicates about the need for shared infrastructures and thinking about ways in which these smaller number of data sets, but very valuable data sets, can be made discoverable in a way in which they aren't really as well discoverable as perhaps they could potentially be. So that's a challenge that I think could usefully be looked at by the funders. So the recommendations, I'm not going to go through them point by point, but just out to pick up a few. So sort of following on from some of the things I was talking about earlier. So one of them is developing a shared output disclosure strategy and processes. So this is really about particularly around the data which is in safe havens or TREs, where it is the limiting factor for people able to access the data is the number of people they can get through the system to check there's no disclosure control on the output. And that's a real block in the system. It's reducing. It's difficult to scale that very quickly. So developing shared output disclosure strategy and processes is part of how we can try to make that a much more straightforward process, so that we can get more people through the system, I suppose. Yeah, supporting studies to improve and modernise data management processes and infrastructure, and again incentivising them to use shared resources where possible, because data infrastructures are complicated things, and it needs a different set of skills perhaps to running studies, and you know, shared infrastructures could be part of that solution in some cases, to try to make it more straightforward to process data and make data more discoverable and shared. So on this one, I pick up a third one particularly, which is to put in place better mechanisms for studies to interact with departments. So the one things underneath the figures earlier around data linkage is that some of that education linkages is several government departments or agencies. So it's not just the DFE, it's the student loans company, it's a whole range of other different agencies that are now sprung up over the last 10, 15 years. And so you're having to approach each one individually. So, you know, trying to find some mechanism to sort of help to sort of triage that, centralise it, work out processes that are more efficient would be, you know, quite important to making sure that the linkage can be done in a reasonable amount of time. Linkages have been taking a long time to do. I think anything we can do to try to reduce that the burden on studies and also the burden on the departments, to be fair, of making it happen is an important part. And the other thing around common research, safe researcher training is there's, you know, likely to be, if Goldacre is to be believed, proliferation of TREs, and you know, that will mean we should really try to have similar processes for researchers to access them. Otherwise, it's just going to be a massive barrier to the researchers accessing data in different places. I didn't mention it earlier, but samples is one of the things, and we have a couple of recommendations on that. One is there's the UK CRC have a register of samples, and you know, having those, which is a national resource, having them there will make the availability of samples much more straightforward to access for researchers who want to look at using those samples. And alongside that is some level of agreement about what the policies and the information that's given to researchers about what the depletion policies are, the governance policies. So a consistent set of information is available to researchers, so they're not having to navigate different processes and procedures for different studies when they want to apply for access to the samples. And that has been, I think, a problem for many researchers, and that should be something that should be quite achievable, I think, in the short term. And then the last recommendations are around metadata. The key one, from my perspective, has been the establishment of metadata office, and I think one of the things that is, I think people in the principle think metadata is a great idea. I think there just needs awareness and training and some assistance to do these things to help make their data discoverable. So I think some organisation that's able to help coordinate and give good advice and things like that would be a significant help to a lot of the studies in terms of thinking about what their strategies are going to be for making data more discoverable and easier to access for researchers. And then the other recommendations around what sort of catalogue would be helpful. It's not necessarily a good idea to try to put all of the studies into closer discovery, because there's, you know, sort of cost benefit to do with that. If there's not that much data usage, not that many researchers going to use it for all sorts of historical reasons, or it's a relatively narrow subject area, then investing that time for those number of researchers might not make sense. But having a discoverable catalogue across all of the resources is really important to know what's available and to make some informed decisions, which is quite difficult at the moment, having to run around different resources trying to work out what's there. And then the last one is around a federated discovery, which is about where you've got resources, trying to make sure that they're discoverable across the big resources, rather than trying to have one portal to all them all, but to have a range of services that you can then link and discover across, and that might make more sense from a sort of technical point of view, and also just organisationally, to you know, leverage existing resources, so closer global aging, and biobank, established resources, a lot of investment. We don't want to rip that up and start again. Try to think about ways in which we could discover across those three, leveraging all the investments already been made in a sort of efficient way. So that's me. If you aren't already signed up to a newsletter, please do so. Keep in touch.